Now, the recent sharp rise in cases is pushing thousands of patients into intensive care units that are already overwhelmed. In response, healthcare workers are now pleading with the public, asking all of us to take more precautions against COVID. The average number of daily COVID hospitalizations nationwide, nearly 69,000. That's up 14.2% in just the last 2 weeks. ICU hospitalizations, intensive care units, are up just over 9%. Doctors and nurses are at their limits, reporting exhaustion and fatigue as they face yet another COVID wave. Let's bring in NBC News reporter Daniela Silva for more on this. Daniela, we've seen healthcare workers express exhaustion and fatigue throughout this pandemic, starting in March of 2020, now again. Does this feel different this time around for healthcare workers? What are they seeing inside their hospitals right now?
Good morning. Hospitals told me that they are once again seeing their numbers skyrocket, and some are at a breaking point. This time, the surge is fueled by the arrival of the highly contagious Omicron variant, the ongoing battle against Delta, unvaccinated patients needing treatment, and managing a shortage of much-needed staff. One health official told me in the Minneapolis area, there are 200 to 400 people every morning in emergency rooms waiting for beds they need to open up. A hospital there brought in a refrigerator truck to help its morgue capacity. Cleveland Clinic in Ohio said many ICUs and emergency rooms are at 100 to 120% capacity.
And that's what we're seeing right now, and we know there's still going to be even more cases going up after the holidays, especially with the number of families getting together. I want to talk about Massachusetts. Just yesterday, the state announced it will be calling on the National Guard to help with the surge of cases. Let's take a listen.
Hospitals across Massachusetts are experiencing an unprecedented demand, and there remains a critical staffing shortage in many jobs and many roles to meet the needs of our patients. We're committed to ensuring our healthcare system meets the acute care needs of our residents. To support hospitals that are experiencing staffing shortages, the governor is activating up to 500 members of the Massachusetts National Guard to ensure sufficient non-medical personnel are available to deliver support to patients.
Daniela, how are these staffing shortages impacting care in states that are just so desperate for help right now?
Yeah, healthcare officials told me the staffing shortages right now are a national crisis, compounded with wave after wave of COVID cases. In Rhode Island, one wrote a letter to the governor saying emergency departments were reporting anywhere from 25 to 50% of their nursing positions vacant, and inpatient units were equally starved for staffing. At Cleveland Clinic, officials said they haven't had enough nurses, enough personnel to just deal with the surge of patients. They said the healthcare community's biggest fears right now are patients dying because of treatable illness or not receiving the appropriate care they need because of these shortages.
So, Daniela, with Omicron now the dominant strain in the U.S., quickly becoming the dominant strain, how worried are healthcare workers about the weeks ahead?
Healthcare workers told me the next few weeks are exactly what they fear as Omicron cases rise, while many are still battling the Delta surge too. In Massachusetts, one official described it as an impending sense of doom. Others have said they're really terrified of what's to come, and they can't imagine having to treat more patients than they are now.
All right, Daniela, you can read more of her reporting on NBCnews.com. The headline, "I am terrified right now." That's a quote from a healthcare worker she spoke with. Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.